Dr. Rick Brown. I am the program manager that covers antimicrobial resistance in WHO Thailand. And I will maybe ask my colleagues to introduce themselves when they're going to give their presentations. We were given 30 minutes, and we all thought it was important that we should have equal time to present the work that our organizations are doing, which is really in keeping with the spirit of this tripartite organization and a reflection of the way we work together in an atmosphere of collaboration and, I guess, mutual respect. So I'm giving the first presentation, so I will start. Should say, while I'm waiting, also thanks very much for being provided with an opportunity to provide these updates. So do we have our presentation? Can we have the presentation from WHO? It's the one that has the blue slide at the beginning. Okay, so what I'm going to do is provide really a global overview that applies equally to both the animal and human health sectors rather than focus on the work of WHO. So maybe I can have the first slide. So as you've heard already, people are now talking about antimicrobial resistance as possibly the greatest threat to modern medicine that we're facing. And our relatively new Director General, Dr. Tedros, has taken up this theme and this message, saying that antibiotic resistance is a global health crisis that should be addressed with the utmost urgency. Can I have the next slide? This slide is showing graphically something that you all know, which is about the importance of the timeline on antibiotic discovery and the development of resistance. So what you see underneath the line is the date of the discovery or development of different classes of antibiotics represented by different colors. And above the line is the date at which resistance developed. So you can see for most of these, it happened relatively quickly. But also, as the orange circle is showing, it's 30 years since a new major class of antibiotics was last discovered. So this is the problem we're facing. When you hear talking about the antibiotic pipeline, the tools that we already have are at risk of becoming less useful because of the development of resistance, and we don't have much in the way of new antibiotics coming. And also, we're all talking and thinking about the progress towards achieving the Sustainable Development Goals. So this is not just about human health, it's about development in general. But there is a link between AMR and many of the different SDGs. So the first SDG, we know that antimicrobial resistance probably has its big impact on the poor. The rate of resistance in people less well off who are being treated is high. And there are also problems with the cost of medicine and access to care, and also sometimes poor measures to prevent infection. And then for SDG 2, we're seeing untreatable infections in animals, which potentially threaten sustainable food production. And then for SDG 3, the ability to treat infections is a fundamental component of all health systems. And then for SDG 6, we are also concerned about the contamination to water of antibiotic residues, not just water, but the environment, obviously. Antibiotic residues when antibiotics are disposed of, both from hospitals but also in agricultural practice. And then for SDG 8, the financial burden of AMR, if we don't take good action, is predicted to be huge by 2050. Also, it's crucial to balance access, innovation and conservation of antimicrobials to contain AMR. And lastly, for SDG 7, as you've heard and as reflected by the incredibly impressive broad participation in this meeting, which also reflects the commitment of Thailand, we require multiple partnerships of different stakeholders to tackle this problem. Now, this slide is it's not directly about antimicrobial resistance, but what it is showing is for different countries, the estimated burden of infectious diseases measured by daily adjusted life years against the gross domestic product of those countries. So what it's essentially showing is that there is a tendency for the countries with the biggest burden of infectious diseases to be the poorest countries. And this has implications for treatment of infectious diseases, but also the development of antimicrobial resistance. In fact, what it's showing is really that Africa faces one of the biggest challenges if we're talking about the different regions. And more specifically about the financial resources that are directed towards healthcare, we know that there are big differences between countries. So again, this is the same information but more specific to health. Some of the countries with the biggest burden are directing lesser resources towards to healthcare programs in general. But the other point about this slide is actually about the we go back. Yeah, is actually no, the slide before still. Yeah, what it's showing in the difference between government and expenditure and total expenditure is actually the out-of-pocket costs. So a lot of the burden of healthcare in many countries is falling to members of the public. And I think this is an additional problem when we're thinking about tackling AMR. So next slide. And then to compound the problem, the workforce that's available in different countries also is very different according to where you are. And it's encouraging to see that there are lots of pharmacists as well as doctors. So this is talking about human health, obviously. But again, for some countries, this is going to represent a real challenge. Next slide, please. So to help to take this issue on in a practical way, this global action plan was developed. And of course, not just by WHO, but also by all concerned UN agencies in collaboration with partners and with technical input from all the relevant experts. And the components of this action plan, at least the strategic objectives I will read out, it's firstly to improve awareness and understanding. Secondly, to strengthen knowledge through surveillance and research. Thirdly, to reduce the incidence of infection. Then to optimize the use of antimicrobial medicines, and also to ensure sustainable investment in research and development. The Global Action Plan also embraced a number of guiding principles, which I think are actually very, very important. The first is whole of society engagement, including the One Health approach, which we will be hearing more of. But this is reflecting the complexity and the scope of the problem, and the fact that it affects all people. So it can only be tackled with the participation of all societies, including, obviously, members of the public. It also puts a strong emphasis on prevention, including good sanitation, hygiene, infection prevention and control practices, but also, for example, better use of vaccines. If you can prevent someone from getting an infection, then they won't need to be treated. It also places an emphasis on appropriate access. So this is partly about preserving the ability to prevent and treat infections when they present. It also interestingly acknowledges that there are some bacterial infections that are undertreated. So this is not necessarily about decreasing the number of antibiotics used for all conditions. It's about ensuring that the way that they are used is appropriate and that people take on the full responsibility when they're dispensing antibiotics. Then next, sustainability. So as you heard already from Admiral Narong, all countries were to have a national plan with a defined budget within 2 years of the endorsement of the GAP plan. And lastly, incremental targets for implementation. So this is acknowledging that that tackling this problem means very different things according to the country in which you're residing, and that for some countries it will be very, very challenging. They need to set their own agenda, their own timelines to attain these goals. And as you will hear more, as you've heard already, we very much embrace this One Health approach. And this is a reflection that AMR affects humans, animals, plants, and also the environment. And so WHO has for several years partnered with FAO and OIE in particular to adopt a comprehensive approach. And we're also starting to collaborate with UNEP, which is the United Nations Environment Programme, to develop evidence base for AMR impact on the environment. So it's interesting, we're starting to do that, but in Thailand this is something you've already taken on board. You're in some respects a little bit ahead of us. So this slide is showing a snapshot of the state of development of national action plans. So the red color is representing countries where a lot of work needs to be done. And in fact, the green is representing countries that have a national action plan. And actually, I heard just this morning that in fact Lao PDR does have a plan, but it just hasn't been finally endorsed. So from this perspective, this region is doing relatively well. But of course, development of a national action plan or a strategic plan is only really the starting point. But I do find this somewhat encouraging. So the way forward is covered in these three different areas. For governance and multi-sectoral approach, it is important that we identify the stakeholders in different sectors of government and bring them together. And a key part of this is to have a high-level AMR coordination committee, but also to identify sources of sustainable financing. It's also important to systematically strengthen systems. And some of the important components of this are laboratory capacity and also strengthening surveillance, including laboratory surveillance, but also epidemiological surveillance. Then to look carefully at the antimicrobial supply chain and also to monitor and control consumption of antimicrobials. And then also to strengthen infection prevention and control and antimicrobial stewardship programs. And then the last component, awareness raising and health education. You have heard already about the World Antibiotic Awareness Week campaigns. But it's also important that we pay some attention to the health professionals' curriculum and do what we can to raise awareness amongst all stakeholders, but including members of the public, and strengthen advocacy. And I think this is my last slide, but I think what I can reflect on seeing this list is that Thailand is taking action in all these areas. So I really applaud the fantastic work that you're doing. this is really just to end off the presentation. This is just one of the graphics from the World Antibiotic Awareness Week. But with this, I will hand over to Mary Joy Gordon, CEO. Oh, who has her own microphone.
So I just